Well, hello, and thank you for joining us today. I'm John Headlee, President of Ten Adams, and I lead a healthcare-focused brand development and marketing communications firm. We'd like to welcome you to the first of our 5-part webinar series. And today, Stratasan and Ten Adams are kicking off our strategic planning and marketing insights for hospital webinar series. And we're beginning today with our focus on objective, data-driven strategic planning. And you can see the topics and dates for the other webinar sessions that you registered for and will be delivered over the next few months. Our webinars are primarily focused on the person wearing both the marketing hat and the strategic planner hat, or somebody who wants to know more about marketing and planning. We're going to zero in on ways to use data, technology, community health initiatives, and branding to build a cohesive strategic plan that really empowers the marketing process and ultimately makes you more successful. Well, today as we share our insights, if you have questions, you can type those questions in the Q&A box that's a part of your WebEx platform, and we'll have time at the end of the webinar today to try and answer those. And also just to let you know that we are recording this, and this webinar will be made available to you within the next week. So now I'd like to introduce to you Leanne Lambdin. And Leanne is going to be presenting the majority of today's material. Leanne is Vice President of Strategic Resources for Stratasan, a healthcare planning and marketing data analytics solution company. Leanne has 24 years of hospital strategic planning experience and just brings a lot of relevant thinking to the table. Leanne?
Thanks, John. Hello, everyone. So what are we talking about in today's webinar? We're going to be talking about the analytic framework of a market analysis and how to use that market analysis to determine strategy. I'm also going to cover the most common mistakes I've seen organizations make in their strategic planning over my 24 years. We're going to focus primarily on the market assessment and the organization's position in its own market. I'll also delve into using the objective data-driven information to determine strategies, how to use it to assist with facilitation, and ultimately to drive decisions. So we're being very aggressive. We're also going to talk about needed data for your market assessment, data visualization, data tools, and other data sources available for strategic planning. So some of you may find parts of the presentation elementary, but it's been our experience that although some organizations are very good at some part of the planning process, hardly any organization excels at all of the different pieces. So first let's start at the 50,000 foot level with what is strategic planning? Strategic planning is defined as answering a set of 3 questions. Where we go, where are we going, and how will we get there? And that sounds a little simplistic, but strategic planning stripped down to its essence is robust answers to those questions. So where are we is the environmental assessment or the situation analysis or market research analysis or market scan or strategy pack. Our customers call this by a lot of different names. But regardless of what you call it, it is objectively assessing where we are in our market. It's looking at who are our competitors, what are our strengths and weaknesses, what are our market opportunities and threats, and answering the question, what is our mission? So the mission is the organization's fundamental reason for being, guiding and inspiring the organization. So the mission is your fundamental reason for being. It should last 100 years, and it's like a guiding star on the horizon, forever pursued but never reached. I'd love to say I wrote that, but I didn't. I took it from Built to Last by Collins and Porras. It's a great book on mission, purpose, values, and vision. So the mission is how you're going to address your market. So the next question is, where are we going? And that's really the vision piece. So the vision articulates what the organization aspires to become, to achieve, and to create. A vision and strategic priorities are key to conveying organizational direction, alignment, and great inspiration. So how will we get there is really a gap analysis between where we are now and our vision of the future. So it contains concrete plans, goals, objectives, tactics, accountabilities, and deadlines. So goals that are SMART, specific, measurable, achievable, realistic, and timely, are essential. So we need to outline what are we doing and who's responsible. So one recommendation I always have is making a person accountable for tactics, never a committee or a group. People always feel more accountable when there's a name by an activity, and set firm deadlines for the tactics and actions. A good implementation plan is more important than the strategic priorities. You can have the greatest vision ever articulated and great strategic priorities, but if you can't implement, you'll never really get there. So in my years of planning, I found organizations to be really less good at realistically determining their current market position than the other two questions. And I'll give you a couple of examples, but one is there are some really bad hospital mission statements out there. I found one that was the mission of community hospitals to provide competent, innovative, accessible emergency and acute care services for the residents of blank county. Not really inspiring, doesn't really get you out of bed in the morning, but think about one that says something like improve the quality of care, improve the quality of life through better care. So this is the DIKW pyramid. It's a tool used in knowledge and information management. So Stratasan's philosophy is to move customers from data up the pyramid. So Stratasan, as John mentioned, is a marketing and planning analytics company. I'm going to tell you a little bit about us, and then I can jump into more of our philosophy along the DIKW pyramid. So we provide hospitals information so they can provide the knowledge and wisdom to create strategic and marketing plans. We are not consultants. We provide software and services to our customers. We have products such as our market research analysis, which is the environmental assessment, and micro-target marketing that we provide to our customers via PowerPoint, as well as our online tool where hospitals can generate their own reports and queries. And the DIKW really encapsulates our company's philosophy. So data is the base of the pyramid. It is the foundation of your situation analysis or market brief. This is the state data that you use to create your market share or the demographic data or your internal patient data. It's just data. It doesn't really mean anything by itself until you do something with it. So information is created by organizing and structuring that data so that it makes sense. So you put it into tables with percentages, you graph it, you make a map of it, you do an infographic. So you're taking that data and turning it into information. So the knowledge is gained from the information created from the data. So knowledge is using the information to make a decision or influence a decision, which is really sort of your ultimate goal here. And you all in your local markets have knowledge about your markets that no one else has. You just need help with your data to get out of the data treadmill and change that into information so that you can focus on knowledge. And then wisdom is what I call true understanding. Picture the light bulb overhead. So with wisdom, you can make better, more timely decisions and be more confident in those decisions. So your goal as marketers and planners is to move from data as quickly as possible into the rest of the pyramid. So here's a good rule of thumb. You give your CEOs graphs, maps, and pictures, not a notebook of Excel tables. That's always a good rule. So whatever resources are at your fingertips to move from data tables to information, giving graphs, maps, or summaries, use it. And as a marketer planner, you have that backup information for follow-up questions, but provide as much information and not data as you can to your leadership teams. So now we're going to talk a little bit about the data gathering process. There is a lot of sources of information for inclusion and objective data-driven market analysis for a hospital. So this two-page list really just scratches the surface. So you all are familiar with what I call the regular suspects: demographics, market share, some financial data, the payer environment. But I'm going to challenge you to think broader, incorporating information from your community health needs assessment or population health studies and quality, which is available easily online, and you can compare yourselves to your competitors. Psychographics, we'll talk a little bit more about psychographics later. Don't just use demographics. If you have psychographics, which is combining the demographics with the behaviors of a population, it makes it that more robust. Also, look at customer service and experience. Don't forget the emotional aspect of the situation of the data gathering. Our business is really about caring for people, so don't leave that out. Gather information on physician alignment, employee engagement, supplier, vendor, partners, what technology is available. For example, meet with your economic development folks during the information gathering stage. They have information on the community and business development activities. Contact me. Here's my email address. I've got a much more detailed list if you would like it. It's a Word document, but it's a lot more detailed. So another thing that you might want to look at is primary research. So a lot of this information is secondary, but primary research on customers' perceptions or brand association would be great, such as a market telephone or online survey. And even better would be some observations, such as how people access the hospital. And what do I mean by that? So there's a Swiffer example. I bet everybody here has a Swiffer, but I don't know if you know the story of a Swiffer. So Procter & Gamble were looking for a new floor cleaner. What they did is they observed people mopping their floors to help determine how to improve a floor cleaner. And they discovered it took people longer to clean the mop than to actually mop the floor. Therefore, their whole solution focused from how to make a better floor cleaner to how to make a mop you don't have to clean. So that would be something you could do during your implementation. How do people access the hospital? How do they check in? Really provides great information. So one of the biggest mistakes I've seen over and over is service area definition. So this is a great data gathering lesson here. So most hospitals believe their service area is actually far larger than it really is. So I'm going to show you an example. Now, this isn't a customer. I didn't want to embarrass anyone. It's my hospital from my hometown, and I'm recreating a common mistake hospitals make when defining their service area. I don't know if this is actually what they think their service area is, so I'm protecting the innocent. So the first service area on the left is approximately 6 counties. It accounts for 92% of patient origin, and our hospital, Blount Memorial Hospital, has 16% market share. And I would argue that some of these zip codes are not legitimately in our hospital service area. So you may want to serve all of this area, but in reality, if they don't come to you, then you don't actually serve them. So for example, Lenore City, 37771, our market share is 2.3% market share. So that means, not really great at math, 98% of these people don't come to our hospital. Therefore, I probably would not include them in our service area. I really recommend using 3 pieces of information when creating a service area. Look not only at your patient origin, where you get your patients from, but also look at your market share of that zip code and the geographic location of that zip code, which is a map. A great way to help determine whether or not to keep a zip code in your service area is to locate competing hospitals on the map and calculate market share, because all things being equal, people like to go to the closest hospital. It's that all things being equal part. You have to offer the service, reputation. But if there's another hospital in that zip code, chances are you're going to struggle getting a lot of market share. So I created a recommended service area on the right. It's approximately 2 counties, It accounts for 88% of patient origin, and our hospital has 46% market share. So we only lost 4% patient origin, but we gained 30% market share using this service area. So this is our market. We will live or die by what happens in this service area. So focus on what's important and don't major in the minors. What my first boss told me. I thought it's been great advice ever since. Don't major in the minors. You can also create service areas for product lines. A tertiary service line may have a much larger service area than the hospital as a whole. So on our website, stratasan.com, we have a blog post dedicated to the art and science of service area creation, which goes into more depth. We also have a tool on our online planning system called the Service Area Creator that helps hospitals create service areas. So looking at your service area critically is a good conversation to have with the CEO and the board, physicians, using data to support your point of view. Because look at it this way, with dollars as precious as they are, and particularly marketing dollars, focusing your service area where you can have the most impact really just makes financial sense. So look at the service area on the left and imagine trying to market to that service area, and look at the service area on the right and imagine marketing to that service area. It's a much more manageable service area for your small marketing dollars. In a later webinar, we're going to be talking about micro-target marketing to further drill down on opportunity areas within your service area. So now we've gathered the data. Now we're going to organize the data. So avoid information overload, which I know is going to be hard, but focus on important pieces of information, those pieces of information that speak to you. So separate the signal from the noise. And if you're looking at a piece of data and it means nothing to you, then don't feel compelled to include it in your presentation to leadership. Another piece of advice is create beautiful data visualizations. I literally picked this one off the internet because I liked the colors that it was using. It's using graphs. It's using the conditional formatting down here of the red and the green and the yellow. Here's the graphs. Here's arrows. It really helps people understand the data. So the purpose in making data easily understandable is to compress your decision-making time. If people stop arguing about the data, they can focus on making decisions and doing something about the data instead of wasting time discussing the data, which I know happens a lot because there's so much healthcare data now, or there's a lack of it, such as outpatient. So a great strategic planning tool to organize your data is a SWOT analysis, which is strengths, weaknesses, opportunities, and threats. A lot of you have seen this, and I'm going to go over what I think are the good parts and then the challenges of using a SWOT. So strengths and weaknesses are internal to the organization. That means we have some kind of control over these. Opportunities and threats are external to our organization, and most of these are outside the organization's control. So here we go into more detail about what goes into each quadrant. But another mistake that hospitals make in strategic planning is using opinion without data in completing the SWOT analysis. So usually you'll have a meeting with leadership, and the first answer you receive from leadership when asked about what the strengths of your organization are, they may say staff. May be true, but you can't really write staff unless your staff is better than your competitor's staff and you have data to prove it. So what I recommend is you keep digging. It's like the layers of an onion. You have to probe. What makes our staff better than our competitor's staff? What objective data do we have? So it may mean that our customer service scores are higher than our competitors, or our quality scores are higher, both of which may be that objective data-driven strength that we're looking for. But the same goes for weaknesses. You can't pick something such as financial performance as a weakness unless you have an external benchmark, such as your competitor's performance or a state benchmark to compare yourself to. Now, I think opportunities are the most tricky category because most people, when you're working with them on completing a SWOT, they'll say, oh, we have the opportunity to increase market share in zip code 37207. Well, that's not really an opportunity. That's actually the beginning of a goal or the beginning of an opportunity. So again, you have to dig and you have to peel the layers of the onion and say, why do you think there's an opportunity to increase share in this zip code? And people will usually say, well, it's because that zip code's really growing. They may say there's a referring physician located in that zip code. The payer environment in that zip code is really good. So those are the opportunities, not zip code 37207, but the things about 37207 that make it good as an external opportunity. Now, threats are the easiest, especially in healthcare these days. It's declining reimbursement, perhaps declining population, lack of Medicaid expansion, physician community, things that we don't really control that could harm us or are bad. So here I'll put some examples in quality. 30 of our 33 measures are in the top quartile. You could actually, depending on how much detail you want to go into on the SWOT, you could actually outline which of your quality measures are in the top quartile. You've got market share as a strength. You've got some market share as a weakness. Our customer satisfaction is a weakness with 9 of 11 measures in the bottom quartile. Our readmission rates. Now, opportunities, external things that are positive, is a growing elderly population, which uses a lot of health care. And right now, as long as we're still not capitated, that's actually a good thing to have business in the hospital. In this sample case, Medicaid expanded to 5% of the service area. We have a surplus of orthopedic surgeons in the area. That's an opportunity because if we're going to grow our orthopedic surgery business, we need to have a surplus of orthopedic surgeons to fill up their practice to grow our market share. So if we look at threats, we've got some Medicare reimbursement cuts because of ACA. We have IT, patient information security, with all the recent invasions into computer systems. Now we have a deficit of 2 cardiologists. So that means we can't really go out and market cardiology because we don't have the cardiologists to get our patients into. And our competitors' physician alignment strategy in our sample, it appears to be working and it's a threat to our strategy. So alternatively to a SWOT, or actually as a starting point to the SWOT analysis, organize all your information into critical issues categories. So here's a sample list. So as you're gathering your information, try to put it all into these different categories. And then organize and prioritize. Once you've organized your information by category, prioritize the issues. You can use your values, your mission, your vision. If you're using the Studer pillars, you can use those. They don't have to match in number because you have to remember not everything can be a priority. So don't really feel bad if something isn't a priority. If you have a bad core product, quality, or customer service, marketing that service shouldn't be a priority. Focus on your product. A mistake hospitals make is trying to focus on everything at once. So if a hospital chooses not to focus on customer service, to focus on the core product of quality, that's a fine and valid choice. You can't do everything at once. But once you select your strategic priorities, you really need to make a change for the positive. So here's an example of a hospital that made customer service a priority. And it was the Cleveland Clinic. So prior to, I can't remember what year this is, but prior to, they did not have great customer service scores. So the CEO decided that customer interaction, patient satisfaction was going to be a strategic priority. And this is how most strategic priorities happen. They come from the CEO, commitment from the CEO. And now the Cleveland Clinic has jumped to the top of patient satisfaction. So, like I said, don't feel bad if you're not focusing on customer service. The Cleveland Clinic didn't used to. They focused on other things. They did get to patient satisfaction. So we've gathered our data. We've organized our data. We've started to gain some insights through the SWOT. But now we need to really turn that data and information into some knowledge. So use that SWOT. So look at the strengths and identify ways to use those strengths to maximize opportunities. Use those strengths to minimize threats. And continue with using opportunities identified to develop strategies that minimize weaknesses and avoid threats. So take that SWOT analysis and really deconstruct it. So as you can tell, up to this point, the planner or the marketer in charge of strategic planning must be a great facilitator, helping people to reach consensus and building agreement around the data and the insights and the issues and the strategy. So I recommend to all planners and marketers to take any facilitation courses you can and use your objective data-driven planning, because that can help. Because one comment can derail a whole planning session. So let's say you've met with the leadership team. Now you're going to take your data analysis out to a larger group, and a physician looks at your new service area and says, well, I see patients from Knoxville or North Georgia or wherever all the time. Why isn't that included in our service area? So use your information and your data. Show a map of your patient origin. Show your market share. Show that although you do see patients from that area, it's not significant enough to warrant being included in your service area. So I'm going to talk about some visualizations, some dashboards, infographics, maps, which are my favorite, and graphs. So dashboards are great to get data into a format to turn it into information, knowledge, and wisdom. You can also use dashboards to monitor progress on your strategic plan or strategic initiative. It's important to know if the items we are implementing are having the desired effect that we meant for them to. So maybe have a dashboard for each initiative. This example is for a revenue cycle. And remember to assign an owner or an accountable person for each initiative. Now, dashboards don't have to be fancy. Some of my favorite are actually just tricked out Excel spreadsheets. So we use dashboards similar to these when doing our community health needs assessments. So here we have our strategy. We have some measures that we've determined. We have a place to put our measures. And here's our target or our comparative, maybe our benchmark. And then here's our status, again, using arrows, using red, yellow, green. We use this one for our community health needs assessment, so you could imagine your community health measures down through here, and then how you compare to the state or the U.S. It really gives you an idea of where we stand and perhaps where we need to go. And these are very easy to make. You don't need any special tools. You need an Excel spreadsheet. Now, infographics are also great because I'm a big fan of Rod Stewart. Every picture tells a story. And as marketers, those of you who are marketers, you may have a particular skill set that's great for creating infographics. So what I would do is take your entire strategic plan and show how it will achieve your vision over time. That would be a great infographic to communicate your strategic plan to your staff, to the community, and you could do a great infographic. So here's an infographic that Stratasan did as a market study of Orlando, Florida. It takes key pieces of their whole environmental assessment and turns it into an easily accessible story that anybody could see. You could hang it up in your hospital. Because I highly recommend making the information as readily accessible and transparent as possible. So imagine your entire market analysis on one infographic. Take key pieces of information and arrange it to tell a story. So here we have the demographics, population, we have insurance coverage, hospital beds, insurance. We have the health factors from the county health rankings. We have our physician needs analysis, our health service demand. We have our out-of-market migration, and we have market share. Here just happens to be orthopedics, but you could have one graph for each of your top service lines. And then you could have this up in your hospital. So some people have worried about, I'm going to go back to this just a second. Some people have worried about making this information so transparent if you had it hanging in the hospital, or you had an infographic of your strategic plan that you put in the newspaper. And I say don't worry. The key to success is not the perfect environmental assessment or vision or strategies, but it's really how well you implement. Most of the information in an environmental assessment is public information, and service areas differ. So even if your competitor got a hold of it, the key is really what you do with it. So I just wanted to cover that. Another thing, mapping, one of my favorite tools for data visualization, turning it into information. This is a total market inpatient origin by zip for all hospitals. And it really shows you the hot spots of where most of the inpatient activity is. So this would take a huge Excel spreadsheet, and that wouldn't really be turning anything into information. But by looking at the map, you can easily tell. Now, imagine you take your patient data and you geocode it to an address level, to a rooftop, and you place it on top of the market data, and you can see where opportunities are. So let's say you had dots, but you had no dots in 37013, meaning you didn't see patients from 37013, but there were a lot of patients there, and it's near your hospital. That, boom, opportunity, and you can see it pretty quickly and pretty clearly. Here's some more maps. You can do this for service line. So you'll have your behavioral discharges, you'll have your hospital's discharges, and then your hospital's market share. So this one slide shows more than an Excel table ever could. Now, I mentioned tapestry segmentation earlier. So you may not be using psychographic data in your planning and marketing, but I highly recommend it. Our customers find it really valuable. So your demographics are what you are, your age, your sex, your race, income, population. Psychographics are more who you are, which is really how you spend your money and your behaviors. So if you do a tapestry segment map by block group of your service area, you can start to pick out what are some of the segments that you would like to serve, or just what is in your service area first. Then you can drill down to which ones you want to serve. And they have cute names like Suburban Splendor, Boombergs, and it tells you a little bit about them. But it really gives you more insight into your service area. Graphs are also great. So here we did payer mix of a service area, and then you can see how your payer mix, these are all fake hospitals, by the way, you can see how your payer mix differs from the market. So in ours, we get a little less commercial, we get a little more Medicare, and a little more Medicaid than the entire market. And we can see that Regional Medical Center and Memorial Hospital are getting more of the commercial patients, and particularly Memorial, less of the Medicare. So I mentioned transparent access a minute ago. And I used to work at a health system, this was a long time ago, and the planning person walked around with a 3-ring binder with all the planning data in it, and he only told people what they needed to know. So only he had the whole picture. So you can imagine the lost opportunities. So I think that by being open and transparent and having widespread access, it enables you to move to the point in the organization where no one is arguing about the sources and the accuracy of the data, but what to do about the data. So make the key pieces available to everyone, put it on bulletin boards or the hospital's intranet. You can be as high-tech or low-tech. And again, don't feel apprehensive about competitors getting a hold on it. You can create it thinking that competitors are going to see it. If that makes you feel better, and really focus on implementation. And if you do have really something super secret, like where you're going to place an urgent care, you don't have to put that on your public information. But you can give people as much data information as you can. So all of this objective data-driven planning leads to determining our strategy, which is really where we need to get. So once the information is turned into knowledge based on your excellent visualizations and your excellent data organization skills, your goals are identified and prioritized based on your SWOT analysis, So then strategies can be developed with implementation plans to close that gap between the vision and your current situation. So here are just some helpful tips for strategic planning in general. The result of a good plan is really good decision making. So having that objective, data-driven information really helps increase and drive decision making. Build coalitions. This is when your facilitation skills come in handy. Build coalition across the organization to implement. Don't be afraid to fail. Think what's the worst that can happen, and if you can live with that, then you're doing okay. And implement. Having the perfect strategy isn't as important as implementing an okay strategy. So, John.
Well, Leanne, I think you've shared a very solid framework for using data to drive the strategic planning process. Thank you. You know, you referred at the start of the presentation that you might be focused on some of the basics, but I think it's so key to cover those basics. As you referenced, there's so many healthcare organizations who have data and information, but they're not fully using it to connect the dots and really refine their strategy. And I think it's our objective as we're doing this work to help people not just do what they've always done. As marketers and planners, we must do what we know, not what just a CEO, leader, or physician feels. So, you know, today we have to make smart decisions, and you've given some great examples of ways to fully leverage and maximize those precious marketing budgets. So until then, we're going to continue to preach our message, and on the screen here, we've got the details of when the next webinar is planned, which will be on Tuesday, June 9th, again at 12 o'clock Eastern Time. So I want to take the time that we have left and look at a couple of questions that have been asked. And one of those is, you know, how often should a hospital go through this process?
Oh, well, that's a great question, and there's actually a couple answers. One is all the time, and we're actually going to have a webinar towards the end of the series that talks about constant state planning. But really, you should be evaluating your situation all the time. So, for example, we urge our customers to have a planning calendar so that perhaps every 3 years they may go through the mission, the vision, and a full-blown data organization and gathering exercise, but have a calendar so that all throughout the 3 years, you're looking at different pieces of your organization. So, for example, you'll go through your full-blown strategic planning process, putting together your mission, your vision, your implementation plan, and then you might focus on cardiology and do a cardiology deep dive. Or you might look at your marketing with a micro-target marketing project where you really look at some key areas within your service area by block group. And just carry those exercises throughout the whole 3 years. So I would go through the whole process every 3 years with some planning activities going on at all times throughout the 3 years.
Okay, well, you know, very closely related to that question that you've just answered is, as you're going through that process, who should really be involved in the planning?
Well, in my experience, the senior leadership, the CEO, and the leadership team should set the vision and the mission and perhaps those strategic priorities that we mentioned. And then I would involve quite seriously as many people as possible. I once was at a health system where we had 2 planning sessions with 400 people in each. Actually, we had 3 planning sessions with 400 people. And management leadership had said, here's what's non-negotiable. Here's our mission. Here's our vision. Here's our strategic priorities. Other than that, we want your input. So we want your input on how to make these things happen. It focused a lot on understanding where management had come from and how management had created the mission, the vision, and the priorities. So it was a review of some data and information, but really 400 people in this health system were involved in that next level. So that's why I was really talking about the transparency and getting the information out to as many people, because I really think we can involve more people in planning than just the leadership team or the medical staff or the board, which I didn't mention the board, but actually strategic planning, if you're a not-for-profit, a 501c3 or governmental, your board has a huge responsibility in strategic planning. Again, setting the direction, the mission, the vision, and the values, and the strategic priorities. But beyond that, I would recommend getting as many people involved as possible.
Okay, thank you. Well, just wanted to remind everyone that we will have this information to be downloaded after the presentation concludes within the next week. And on the next slide, we've got our contact information, and if there's anything that has been discussed or shared today, please feel free and welcome to reach out to Leanne, and we'll remind you that we will be continuing this series again on June 9th and looking at how to integrate your community health needs assessment into your strategy. And during that time, I'll share an example of really how to leverage that process and transform the community with real measurable results, and some ways to extend your community health needs assessment to create an effective wellness initiative from the inside out. So we thank you for joining us today and look forward and hope to see you on June 9th. Thank you.